health equity versus health disparity. Is there a way of explaining why you're using a different term now?
Well, to me, you can't understand why you would focus on health disparities without reference to health equity. That health equity is the principle. I mean equity
It's the
meaning
thing you're trying to
justice.
get.
Meaning exactly. That's where we're headed, toward greater health equity. But we need the disparities in there because it's by measuring disparities and whether they narrow over time that we can assess whether we're headed in the right,
whether these
in the right
policies
direction.
that we're spending a lot of time, energy, and money on are headed in the right direction.
Right. And that I know, there was a fascinating discussion last night that the Colorado Trust arranged with some local leaders, and someone brought up the issue that people get the term disparities, but when you start talking health equity, it sounds so abstract and vague, and I think that that's true, and that's
Yes.
unfortunate. I think the most important thing is that we're the people who are leading efforts, designing efforts for greater health equity, that we know why we're doing it and can explain that and can defend it. So and we don't necessarily have to carry a banner and wave it with it says health equity on it all the time if what people are going to relate to is the disparities. But I've been in situations where it's because people weren't clear on why they were trying to reduce the disparities that they really got off track. And because that there are lots of health differences, right? I mean, younger adults are healthier than elderly adults, but that's not the kind of if you just
That's
look
not
at
the disparity we're talking about.
Yeah,
Right.
And and a rich community could say, well, we have this health problem that this other rich community doesn't have.
Oh, I see.
That's a disparity. So why aren't we devoting the resources to that? It's because we're headed for equity. So.
When you were talking about the comparisons to other countries, overall, how does the longevity in the U.S. compare to other countries?
Very poorly. We have one of the lowest life expectancies here, unless you're 75 years old. And if you have made it to 75, then we have one of the best life expectancies for those who get there.
Not coincidentally, because Medicare kicks in at 65 and everybody gets health insurance. There's not a complete overlap in those issues, but that's one of the reasons.
And another reason that people think that if you've made it to 75, you're kind of unusually healthy. That this is the unusually healthy part of the population for whatever reason.